A hospitalist is a board-certified physician who specializes in the inpatient side of taking care of patients who are admitted to hospital. Most hospitalists go through the 3-year residency training that is necessary to have a license to practice in the United States. Some hospitalists choose to do additional training in the form of a fellowship. Some have additional training with areas of critical care. We're a team of healthcare providers, and we have physicians, nurse practitioners, physician assistants, nurses all on the team who work cohesively as a unit to provide the best possible care for the patients we have admitted in the hospital. We round on our patients daily. We communicate with one another on a regular basis and certainly keep in touch with the patient's family members and the patient's primary care physician to make sure that everyone is on board and on the same page with regard to what's happening with the patient's care. We are available around the clock in the hospital, and this provides the best possible care that can be provided to a patient while they are in the hospital. Hospitalists don't take care of adult patients only, they take care of pediatric patients. There are special hospitalists who are surgeons who see patients in the inpatient area only, and they're called surgical hospitalists. There are hospitalists who are OBGYN physicians and who do labor and delivery work exclusively, and they're called laborists. So it is something that extends across the broad spectrum of the medical sciences. Usually the hospitalist takes over the care of the inpatient side of medical care from the primary care physician for the duration that the patient is in hospital. As far as the surgical specialties go, we work very closely with the surgeons. Their training, especially with regard to doing the procedures that they perform, while the hospitalists take care of all the other medical needs of the patient while they're in hospital. And so we work very closely with the surgeons and the surgical specialties to provide the best possible care for the patients. One, of course, is direct communication, and we try to keep in touch with the patient's family physician on a regular basis. In addition, we also have in Trinity Mother Frances the electronic medical record system called EPIC and Connect Care, and that is also a means by which the primary care physician can keep up to date with what's going on with their patient in the hospital, because that information can be accessed by the primary care physician at any time. Most hospitalists usually work in shifts of 7 to 10 days or so at a time. So if a patient is in the hospital for longer than that duration, it is very likely that they will be seeing more than one hospitalist provider. However, that is not to say that we don't communicate. We certainly have a process of handing over care of the patient and communication concomitantly with the transition of care, so that the new hospitalist is aware of some of the issues that are going on with the patients that they're taking over care for. The patient should definitely schedule a visit with their primary care physician, because it's very important to have that post-discharge follow-up visit for the primary care physician to know what's going on and just get up to date with regard to what's been happening in the hospital. This is over and above the communication that they would receive directly from the hospitalist. However, hospitalists, by virtue of seeing patients only in the hospital, usually do not do post-discharge follow-up visits.